I have a question for you. Do you know when we have a normal heart rate? And do you know when we have a fast heart rate? Let me explain it. Actually, we have many factors affecting the heart rate. So, we will explore it in this video together. Let's start. We have many factors affecting heart rate, starting by exercise, stress and anxiety, fever, medications, overactive thyroid gland, which we call it hyperthyroidism, also high dose of caffeine, and sometimes hormone changes. Exercise. As all we know that exercise strengthens our muscles. It helps our heart muscle to become more efficient and better able to pump blood throughout the body. This means that the heart pushes out more blood with each beat, allowing it to beat faster and keep our blood pressure under control. Let's move to stress and anxiety. These emotions cause a release of stress hormones that make our heart beat faster. Sometimes we go in a case we call it fight or flight, whether there is a real or imagined danger. Intense fear may cause a panic attack that associated with symptoms like racing heart, difficulty breathing, chest pain, sweating, and chills. By talking about fever also, it will increase the heart rate, breathing rate, blood circulation to the skin. And that's how we can reduce the heat of the body. Medications. Several medications can affect the electrical signals in our heart and make our heart beat faster. The medical term for a fast heartbeat, we call it tachycardia. If we have this case, sometimes we can feel lightheaded or dizzy. Not only that, we have another type of drugs, we call them cardiostimulatory. And sometimes we call it cardiotonic drugs, which will enhance cardiac function by increase the heart rate, and myocardial contractility, which will increase the cardiac output and arterial pressure. Overactive thyroid gland, in another term, hyperthyroidism. Thyroid hormone or thyroxine influences the force and speed of our heartbeat, our blood pressure, and our cholesterol level. Not only that, an excess of thyroid hormones increases cardiac contractility and resting heart rate. Cardiac output may increase by 50 to 300%. Caffeine. Taking high doses raises our blood level of epinephrine. Epinephrine, known as adrenaline, in pure forms. Adrenaline can increase the blood pressure, the contractility or force of the heart, and mildly increase the heart rate. Caffeine acts as a stimulant that increases heart rate, which is found in coffee, tea, chocolate, soda, energy drinks, and other foods and beverages. Hormone changes. Hormone changes associated with menstruation, pregnancy, premenopause, and menopause. Such emotions cause heart palpitations. Many women want to know how to stop heart palpitations during pregnancy and times associated with hormone changes. Heart rate fluctuations due to hormonal changes are usually temporary and not a cause for concern. After knowing what causes the increase of heart rate, still I have a concern about what causes the low heart rate. Listen, in this case, we call it bradycardia. We have many causes. Heart tissue damage related to aging, or damage to heart tissues from heart disease or heart attack. Sometimes, heart disorder present at birth, which we call it congenital heart defect. Infection of heart tissues, myocarditis, a complication of heart surgery. And the last thing, sometimes hypothyroidism, which is the opposite of hyperthyroidism. That means underactive thyroid gland. Thanks for watching.